Hello, I'm Dr. Stephen Reidbord, and this is More Than Meds, where I talk about psychotherapy and psychologically informed psychiatry. Today I'd like to talk about virtual treatment, online therapy. This isn't a new idea, not by a long shot. Sigmund Freud, who arguably invented psychotherapy in the West over 100 years ago, would psychoanalyze letters that he received from his patients. And since then, for decades, the telephone has been used to do therapy either on an ad hoc basis or when the patient's or the therapist is out of town, or for crisis calls between sessions. It's been used for crisis hotlines, and the use of video conferencing also came into use in the last couple of decades, actually. It wasn't common, though. It was frequently from institution to institution. Say a patient at one medical center would connect electronically with a specialist at another medical center. The idea of doing virtual treatment using your smartphone is, of course, newer than that. This was gaining in popularity very slowly until the pandemic. And then all of a sudden, all of us became virtual, at least for a while. Now that things have mostly returned to normal, I think it's time to take a look at the pros and cons of virtual treatment. It's become a kind of default or a baseline assumption for many people that why would you go to the trouble of seeing a mental health professional in an office when you could just do it from your phone or your tablet or your computer? It overlooks some of the trade-offs involved, and so I'd like to talk to you about that today. There are obvious times when there's really no good alternative but virtual treatment. This doesn't come up very often, but it's worth mentioning that if you as a patient are bedbound because of a medical problem, if you're highly contagious, if you have measles, highly contagious disease, and it's really not a good idea for you to leave the house for that reason. If you are an Antarctic explorer and there's no practical way to get medical or mental health care anywhere near where you are. And then more typically, if you are in an outlying area and there just aren't any providers near where you live or work, or if you need a specialized service and the specialist that you need is not near you, those are all very good reasons to get treatment remotely or virtually. But for most of us who live in urban or suburban America, there's a choice. There are mental health professionals nearby, relatively nearby, and there are virtual treatment options as well. Now, even under those circumstances, there are some advantages to virtual treatment that's pretty easy to think of and to mention. There's no commuting, there's no getting in your car or other vehicle and driving somewhere. There's no parking. There's no taking the time to do the traveling. It may be more private in some respects. You don't have to wait in a waiting room with other people. You don't have to be seen walking into the office, to the building where the office is, if that concerns you. Sometimes it costs less too, and some of those reasons are very practical. If a mental health professional, a psychotherapist or whatever, is only doing virtual treatment, they don't need to rent an office. And that's a real cost savings, which could be passed along to the people they see by having the fees be less. Also, virtual treatment lends itself to more consolidation of services. Those big companies, like the one I talked about in a recent video, save money by having all of the therapists offer virtual treatment. They don't need to rent all that space. They can do most of the infrastructure electronically, and it can just be less expensive for that reason. Also, some people argue, I'm going to question this in a second, but some people argue that certain types of patients or clients, for example, really shy people or people who have agoraphobia and have real panic leaving the house, are better off seeing someone virtually so that they can stay home. In the face of all this ease and convenience, it's easy to overlook some of the advantages of in-person treatment. The first is that, it's actually better for people who are shy and have agoraphobia to leave their house. Reinforcing anxious behavior by not challenging it is not a very good way to treat it. I'm not a behaviorist, but really the most basic form of treating any of these sorts of fears or phobias is to gently expose a person to the thing they fear so that they get over the fear. If you are reluctant to leave the house, if you are shy, if you have agoraphobia and feel panicky leaving the house is actually a good idea. Second, I don't think people really pay enough attention to or consider enough the amount of distractions that occur when you are on your device, right? You get notifications all the time, pop-ups, messages come in, lots of distracting stuff happens on the device you're trying to do therapy with. And that's not good. You don't want to be distracted. Also, because you're not in an office, you're at home or at work or somewhere else, you can be distracted or interrupted by other things. For a while, I saw a patient virtually who would answer the door periodically for deliveries. UPS would be at the door, and I would be staring at the ceiling because I was on his phone while he signed for a package. That doesn't happen when you come into an office for treatment. Also, there's a lot of technical glitches. It's gotten better. The technology will continue to improve, I'm sure. But I can't tell you the number of times that the picture freezes or the audio gets garbled. The patient doesn't know how to turn their camera on. And so only one of us has a picture and the other one doesn't. In some cases, the thing isn't pointed towards them, and so I'm looking at the side of their face, or I'm looking at something else. I used to have a patient who would hold I guess it was their phone, and kind of swing their arm while I was talking to them, so I'm getting dizzy, looking up and down and up and down. None of that, of course, happens when you're sitting in a room with an actual other person. Also, there really is more privacy, not less, when you come into an office to see someone. I won't even really get into the question of whether some of these therapy companies use your data, right, or take your data. They're not supposed to, but sometimes they have sold data because your data is valuable. None of that happens if you're seeing somebody in an office. But it's also more private because of where you do it. I have seen patients virtually who are they're at home, but they have someone else at home who they don't want to hear them talking, or they have somebody else at home whom they're complaining about or who they have conflicts with, and they have to talk really quietly and worry whether the other person can hear them. I've had patients who are in semi-public places, in the lobby of a hotel. Oh, well, there's no one here right now, but then 5 minutes later, someone's walking by or sits down near them. I've seen many patients virtually who connect from their car. Thankfully, not while they're driving, when it's parked somewhere, but still, that's an awkward place. There's people walking by the car sometimes. It's awkward for them just because of where they are, but they have no other private place to be. That's one big advantage of seeing someone in person. It is set up to be a private place to be, not to have interruptions, um, not to be a compromise. In some of these videos, I refer to something called the therapeutic frame. And maybe this is a good time to talk a little bit more about what that is. It's both a physical idea and a kind of conceptual idea as well. Conceptually, the idea is that for a person to be emotionally vulnerable and emotionally honest with themselves, there needs to be a sense of safety. And some of that safety is a kind of the physical setting of the therapy. If it happens in a place in which a person feels physically secure, which a person feels that their privacy is being respected, and when the roles of both people are pretty well spelled out, that's comforting and reassuring to the person so that they feel better able to talk about difficult topics. Now, some of that can happen in virtual treatment, but it's so easy for it not to happen. When people are walking by, there's not that sense of privacy. But also when patients connect with their therapist while they're in their pajamas or when they're lying in bed, when they have an alcoholic drink in their hand, or if they're sitting by the pool with their swimsuit on. These things change the nature, change the safety, really, of the psychotherapy in a way that isn't really helpful for the therapy. In a kind of related way, having a good therapeutic frame also allows the therapist to notice more subtle things. You're in a quiet room together without other distractions, and the patient or the client has a very slight facial expression or a grimace. The therapist will pick that up. They may not pick it up on a screen. They may not pick it up if there's other distractions happening in the environment. We won't learn as much, and therefore won't be quite as able to help you. It's really important as a therapist to notice if the patient is fidgeting, if they're tapping their foot, if their gaze is averted, if they're looking out the window instead of at the therapist. There's a lot of aspects of body language that gets missed in virtual treatment as well. And then there's some other things, like noticing alcohol on the person's breath, which of course you can't do virtually. Now, if you're trying to hide things from your therapist, that might be an advantage. Likewise, it's a lot safer from the therapist's perspective, certainly, if a patient is in crisis, to have them in the office. If a patient is suicidal and I don't know physically where they are, that's a very bad position for me to be in. Now, if a patient wants to put me on the spot and make me feel really uncomfortable, they can be in a virtual session with me and threaten suicide, and there's nothing I can do about it because they're nowhere near where I am and I don't know where to send emergency services or anything else. That's not good. The point is not that the therapist should have a whole bunch of power in this relationship. The point is that there should be a safe frame, a therapeutic frame within which to work. So if therapy were only about exchanging information, if it was a data exchange, virtual treatment would be fine. But it's not. It's a human relationship. And at base, we humans are animals. Our connection with each other isn't just dry data. It's body language, it's physical proximity, how close or far we are from each other. It's sounds, it's little movements, it could even be smells. As computer people say, it's a very wide bandwidth signal. There's a lot of information any given second being transferred between two people in an in-person relationship. A virtual relationship has a lot of information too, but it's a much narrower signal, much narrower bandwidth signal. Yeah, there's words and there's meanings being transferred back and forth, and visual information too. But so much else is missing. Even now, with screens all around us, where it's become routine and everyday to communicate with each other virtually in all sorts of settings and for all sorts of reasons. Still, in-person meetings are what we rely on, what we most highly value when we want to be the most serious or intimate or honest. So it's a trade-off. Sometimes virtual treatment is really the best or only option. More often, it's a matter of weighing the ease and convenience on the one hand against a fuller experience on the other. One isn't always better than the other. But I'll tell you this. I had a fully virtual practice for a year plus during the pandemic, but I no longer see new patients virtually. I have some existing ones that I still see virtually, but I've made my decision. My practice is about offering the highest quality mental health services that I can. Not the most convenient necessarily, not the least expensive, but the highest quality. Sometimes I say a good analogy is between fine dining and fast food. Fine dining aims to offer the optimal experience. It's expensive, not particularly convenient, it's not fast. Fast food is the opposite. It's a quick way to fill your belly. It's far less expensive. It's a lot easier. You don't need to make a reservation. You don't need to go all over the place. Really, the question is, how important is ease and convenience against a better experience? And that's a decision only you can make. Well, that's it for this week. If you have any questions or comments, please put them below. If you like what I'm doing here, please subscribe. There's always another video for you to take a look at if you like. And I'll see you next time. Bye.